It's a serious epidemic that's occurring with the high rates of overdose. You don't even know what you're taking nowadays.
There's some type of drug out there that is much more potent.
We're finding fake oxys on the street.
Fentanyl is a new addiction, causing a lot of overdoses.
It's a drug that we really need to be aware of. It's killing everybody.
There's new drugs coming out. It's showing up in a lot of different drugs, not just heroin. They're finding it in meth or drugs that you don't expect it to be in.
It's constantly changing.
Somebody thought that they were taking ecstasy. The pill they ingested actually was a strong opiate.
I've lost so many loved ones. My ex-husband has lost loved ones. I don't think that I have a whole lot of friends that haven't lost someone to an overdose. I'm a woman who used to use drugs, opioids specifically. I've been on several overdoses. At the time, we didn't have access to naloxone. It's extremely traumatic, not just for the person, but for everybody around witnessing this, and that feeling of helplessness and powerlessness when you can't do anything.
I've used my kit 42 times.
I just wish in the days that I was using that we had that available. I've watched naloxone used, and I've watched the person come back to breathe again. You see that they're going to be okay.
Who wants to watch somebody die when they can save them so easily? I think that's the bottom line.
And that's what it's all about, is preventing death. They call me Little Doug on the street. I carry naloxone in Surrey. Since I was homeless and in that neighborhood where the demand was, that I could do something useful.
The take-home naloxone program is going to save lives, and it has already.
We know that if naloxone was more readily available, deaths would decrease. This has been systematically and scientifically evaluated.
The naloxone has been around since the 1960s and has been used very safely in hospitals and in other emergency situations. And there's been take-home naloxone programs since the 1990s. We had our first one in Canada in Edmonton in 2005. Toronto was the next one in 2011. BC was the first and long-standing provincial take-home naloxone program.
Because naloxone is so safe and effective, if somebody thinks that their loved one or somebody they don't know is having an overdose of opiates, they should give naloxone. The risks are minimal and the benefits are huge.
Naloxone is going to be available in pharmacies. The pharmacists will be able to do some training and to advise people how to use it. We can increase the reach of naloxone into the general population.
Naloxone, also called Narcan, is safe and easy to use. Know the signs of an overdose. Not all opiates are street drugs, and people can overdose from prescription drugs too.
Fatal overdoses often look like the person is just sleeping until it's too late. Breathing is slow or absent. They're choking, making gurgling sounds or snoring. Their skin feels cold or clammy. Pupils are tiny.
Blue lips, cyanotic, not responding to sound or pain.
If you think someone is overdosing, call 911.
If for any reason you needed to leave the person unattended to say, go grab your phone, you want to put them in what's called the recovery position. Make sure you don't let anybody sleep it off.
Very distressing stories how somebody was asleep, they were snoring, just making strange noises, and they were left to sleep it off.
Find out if that person is responsive or not. That's the bottom line between somebody who may be in a heavy nod and, enjoying their high to where they're dying.
There's a kit that you can easily pack. Open your kit to walk through the steps of trying to rouse them.
Well, after that, stimulate, no response. That's when you want to phone 911 if you can, if you have a phone, or call for help and have somebody else call for you.
Are they coming to? Shout their name, shake them. If they're not, it's totally safe to take the naloxone steps.
Save Me is the steps that you're going to take to respond to an overdose. We got a little cheater sheet inside your kits. S for save me is stimulate, so you want to find out if the person can hear or feel you.
Try to wake them. Call their name. Shake them by their shoulders. Tell them you're going to apply pressure and then rub your knuckles hard against the breastbone. If you cannot wake them, call 911. Tell the operator that a person is not breathing and not responsive. Stay with the person.
A is for airway.
Make certain that there's nothing to obstruct the airway. If the person has any food, gum, chewing tobacco, or other content in their mouth, you want to clear that away.
V is for ventilate, so make sure to give the person breaths.
Breathing mask. You place this over the face,
Tilt the head back.
pinching the nostrils closed so that your breath doesn't come right out, and go into the mouth with your breath.
Continue giving one breath every 5 seconds. Keep breathing for them until the paramedics arrive. Brain damage can occur within minutes without oxygen. E, evaluate. Are they any better? Has breathing or color improved? If not, prepare the naloxone.
M is for muscular injection.
Get your syringe out and your Narcan. Go ahead and give it a swirl.
To gather the liquid at the base. Snap the ampule away from your body.
Uncap the syringe, being very careful of the needle.
Draw up all the liquid.
You can use your eyes to see when you're down to the bottom of the naloxone. Push the air out. You will see the liquid medication come to the tip.
A small amount of air won't matter.
Remember, the areas to inject are large muscle areas.
Inject in the meaty part of the thigh, arm, or butt. Go through clothing if you need to.
Point the needle toward the muscle.
Hold the syringe like a dart at a 90-degree angle and inject until you hear a click.
So when medication is given, the needle is withdrawn back into the syringe.
And E is for evaluate again.
Evaluate and support. Naloxone usually takes effect in 3 to 5 minutes or less.
If they don't respond in 3 to 5 minutes, hit them up again. And if they don't come out of that 3 to 5 minutes, hit them up again until you run out of Narcan. It's not going to hurt them.
Naloxone is safe and will have no effect if opioids are not present.
Remember to breathe for the person every 5 seconds, because that's really what's going on here, is they need breaths.
It is important to stay with the person. When they wake up, explain what happened. They may not remember overdosing. They may even be angry or have mild withdrawal symptoms. The effects of naloxone begin to wear off after 20 minutes. They should not use any more drugs for at least 2 hours. When the emergency response team arrives, tell them what the person has taken and what you've done. Safely dispose of your supplies in a sharps container or plastic bottle with a lid. Don't forget to get more naloxone for your kit.
Remember, your overdose can come back once the Narcan's worn off. This is temporary, and that's why it's important to follow up with emergency.
A person can't just give a dose of naloxone. They need to call 911. If the person has taken a huge overdose, they may need further doses. They need to be in a hospital where we have access to as much naloxone as they could possibly need. Take-home naloxone is extremely fast and effective, but it's not the whole treatment.
There are no sure ways to reverse an overdose other than naloxone. It's the wonder drug that changes the event.
Like a lot of things in life, drug use comes with risks. Using alone is a big one, but you can reduce that risk if you know what to do.
People can overdose even when they're using prescribed drugs.
Opiates that are commonly prescribed for severe pain are codeine, morphine, oxycodone, hydromorphone, and fentanyl.
Either from prescribed use or from unprescribed use, people can overdose from these medications too.
Opioids are commonly prescribed. Canada and the US have the number 1 and the number 2 spot of per person prescription in the world.
If the person starts using their or somebody else's medication in a way that's not prescribed,
They may be on other medications as well, or they may take alcohol. So all these added effects can increase the risk of having an overdose.
with opiates, a person develops tolerance. They then need a higher dose in order to have the same effect. It takes about 2 weeks for that to develop. So if they don't take their opiates for 2 weeks, their tolerance is lost.
If you are someone who's starting up again after being off, you're someone who's recreating, in other words, you're just partying with friends, and you want to go ahead and participate in taking either oral, injecting, or snorting, or popping, you really need to do this with friends.
Stigma and discrimination in the healthcare setting really impacts people's decision about whether or not they want to go to emerge.
So when there's stigma, people won't disclose that they're using. They may go and sit in a room on their own and use, and that's when it's most dangerous.
When you talk about these safety plans in the beginning, to kind of establishing what are we going to do if anything happens. If I overdose, this is what I want you to do for me. If you overdose, what would you like me to do for you? We already have an idea and a plan in place is so important.
I've been an outreach nurse for many, many years. I've been out with people. I've seen them come back from overdose, and I can't tell you how much that means to me because they're alive.
There's going to be someone in your life that's taken an opiate. To abuse it or overdose on it can be very easy, whether on purpose or not.
If you are in a community where there are other users, where this is common, join together, get knowledgeable, form your own peer support group around opioid and other drug use.
And I believe everyone needs to be trained for it. It will empower people because they're helping others.